Yeah, good morning.
Thank you very much. I wish we were talking to you under happier circumstances where life was completely back to normal, no restrictions,
Yeah, so
happy
do I.
Christmas. Let's have a lovely time in 24 days at a time. But we're not there right now. Booster jab's going to be rolled out, 23 million people by the end of January. Do we have the resources to do that right now, given that we don't have all those volunteers on furlough, we don't have those empty communal halls, and we're facing, the normal winter pressures?
Julia, our strategy with this variant is to buy time so we can assess it, but also we can build our defenses. And it's still the case that the best way to build those defenses is with vaccines. It's possible they might be less effective against this new variant, but they're also likely to remain effective, highly effective, potentially against serious disease. And that's why we've made these announcements around the booster program. When it comes to capacity, it is a tough ask. And we've already asked a lot of the NHS on vaccinations, and they have delivered. But I can see from the plans that they're already making in the last 24 hours with the new hospital hubs, the pharmacists, the GPs, the national booking service, that we've got a real ability to do this. And it is an ambition, then, I think the right ambition, to make sure every adult is offered a booster jab by the end of January.
Oh, now, we're told, we better be safe than sorry, but other people might make a different assessment of what they consider to be safe. We don't know if this Omicron variant is going to be more a danger to us. Certainly it appears to be more transmissible, but it does appear it doesn't create more serious illness, hospitalisation, or thankfully death. South Africans think we're overreacting. Spoke to the doctor who identified the variant, who thinks this is everyone is overreacting in the UK and in other countries in the West. Are we going to do this every single time there's a new variant of concern? We're going to assume the worst, we have restrictions on our lives, and we go back to what feels a bit like square one again?
No, not at all. And Julia, what I can share with you is that you might remember just about 3-4 weeks ago, we talked about another variant, right? The A149. And you might not even remember it, and a lot of your listeners might not remember it, because we talked about it and said we had discovered this. We were investigating it. We thought it was more transmissible. And it turned out that it was a bit more transmissible. But we didn't take any of these kinds of measures because, quite sensibly, we realized there will be new variants all the time. And it happens with flu. It's going to happen with COVID. We've got to learn to live with COVID, just as we learn to live with flu. But when a new variant comes along, I think it's all about risk. And in this case, when the scientists have done let's call it a desktop analysis, but they haven't done the proper lab analysis yet, that we only discovered this less than a week ago. In that desktop analysis, just because of the sheer number of mutations that they're seeing, that's what's caused for concern. So the answer to your question is there will be lots of variants. There'll be lots more variants, and we absolutely won't be doing this every time we see a variant.
Let's hope not.
We just do it when there's a particular risk.
Okay, can I ask why the legislation voted on last night, when we're told it's going to be reviewed in the 3 weeks' time on the 20th of December, goes all the way to the 24th of March, even allowing for self-isolation to be legally required in the event of someone coming into close contact with a suspected, not even a proven case of Omicron? That could unleash a whole new problem with another pandemic affecting businesses, affecting also children in school because they're not excluded from this. Why on earth have we got that rule, and why have we got that rule going all the way to the end of March?
Well, that's not. I've seen that report, but it's not really the full picture. And what we've done, in interest of expediency, was to update the current rule on self-isolation, which already existed before this new variant, and that basically applied to people that were unvaccinated and had they come into contact with someone who had a positive case. And it was that existing legislation that was in place until March, and we've updated it. And we mean what we said, that in 3 weeks' time, this new measure will be reviewed, and if we don't need it anymore, it will be taken out straight away, and no one needs to wait till March. It will be taken out straight away if we don't need it.
Okay. Now, you are the Health and Social Care Secretary, not the COVID Secretary, and we know there are other diseases that people still die from. The National Audit Office reporting today that extraordinarily 740,000 cases of cancer referrals from GPs have not happened, have not been made. There will be tens of thousands of people who right now have got cancer, don't know it, not been referred to a doctor, not been treated, and may well die. What are you going to do about that?
And that, Julia, I'm glad you mentioned that. That really troubles me. And you might recall when I first became Health Secretary, I was making clear I am not just the COVID Secretary. I am the Health Secretary. And whether it's cancer, it's heart disease, it's mental health challenges, these are all huge issues that remain as important. And sadly, we've gone backward on all three of those things, and probably more, because of some of the measures that were taken. And I think people understand why that happened, but it is just
I don't think they do.
Yeah,
I think people are very angry about it.
I think people generally, I think they do understand how that's happened. But the important thing is that we must never forget that some of the actions that have been taken in the past, and sometimes people still talk about now, why aren't you doing this and why aren't you doing that? They have consequences, beyond COVID, and certainly you've given an example of COVID health, but also an impact on the economy, people's jobs, people's socializing, people's mental well-being, and these can never be forgotten.
No. Well, in your own constituency, 41% are waiting more than 62 days. I mean, for the referral. I mean, absolutely extraordinary. Can I ask you just finally, I know we've not got you for very long, I have to let you go, but Christmas party advice, are you listening to Jenny Harries? Are you listening to Boris Johnson?
I'm listening to the guidance we already put in place, which means, please do, enjoy yourselves as usual and make your plans. You don't have to change any of your plans because of this new variant, and unless, of course, you've sadly been caught by the travel rules. Perhaps you're planning to go abroad to some of those red-listed countries. But otherwise, just stick to the guidance and follow common sense.
Sajid Javid, Health Secretary, really appreciate that. Thank you very much indeed for joining us. 9:30.